All right, today we're going to learn about the digestive system. So with the digestive system, it's how we intake food and liquids and how it moves throughout our whole body until we eliminate it. Now, let's start with the very beginning of the digestive system. So we're going to draw a lateral view of someone's head like we very commonly do, so we can see where this digestive system begins. All right, so let's see. Before we kind of get started, I want to review one simple thing. Now, this kind of goes for the digestive system in general. In general, it is lined with a few different layers, and I just want to give you a breakdown of what these main layers are. So, main layers of the digestive system in general are mucosa, which is the most deep layer or like inner layer of this tract. So you can kind of think about this digestive tract almost like a tube. And if we're looking at this tube, the deepest is the most inner layer, and the most superficial is the most outer layer of this tube. So this is going to be the deepest. And then the next layer of the digestive tract in general is going to be submucosa. Then it's going to be muscularis, which is exactly what it sounds, a muscular layer, and then serosa. So that is going deep to superficial. All right, so now that we have that established, let's start at the beginning of the digestive system. So to start off, this is as if we're taking a bite of food and we're going to intake that food into our oral cavity, which is going to be right here, exactly what it sounds like, right where the mouth is. That is our oral cavity. Now remember, we talked about a structure before called the pharynx. And remember, we had three parts of that when we were talking about the respiratory system. We reviewed the nasopharynx, oropharynx, and laryngopharynx from superior to inferior. Now, after you take food in, it will go through you'll put it into your mouth. You'll take it in through the oral cavity. And it's going to then go into the oropharynx, which is just going to be a little section right here. Now, the first step of digestion is actually mechanical, and that entails us chewing it up. Chewing the food up. So I do want to draw the teeth out for you, but we're going to do that in a moment after we finish this beginning part of the digestive tract. So after it goes through the oropharynx, we're going to have the laryngopharynx, which is right below the oropharynx. Alrighty, so then the laryngopharynx is going to give way to both the larynx and the trachea, which is anterior. I'm not going to label that just because we already did that before, but we're going to have other structures anteriorly here. And then our posteriorly, we're going to have the laryngopharynx is going to turn into the esophagus. So that's what we're going to draw next. And actually, I like when we have borders around things just so we can see it a little bit more clearly. There we go. That looks a little neater, right? This is actually going to go down very far. So that is going to be another structure that we had drawn out before. That's going to be our esophagus. A few things before we draw that esophagus in, though, is that I want to make a note of a few different types of muscles within that esophagus and a few different sphincters that are involved. Now, whenever we're talking about sphincters, we've talked about this a little bit briefly in the class before, but I want to draw your attention to the fact that these sphincters are like circular muscles that kind of look like my hand here, and they're going to close off or open up to either allow things to pass through or not allow them to. We're actually going to have an upper esophageal sphincter and a lower esophageal sphincter, but in order for us to kind of draw that in a little bit clearer, we're going to have to extend things a little bit. So this is going to be the diaphragm right there. Alrighty, so let's make our upper esophageal sphincter. Let's do it in a brown. Right here. That's going to be our upper esophageal sphincter. Now we're going to color the esophagus in as a whole here. It's going to be this like teal color. That's our esophagus, excuse me. So remember, we're going to have food coming all the way down in here. It's eventually the next going to go in the stomach, but we'll get there in a moment. Now, I want to note that your esophagus is made up of different kinds of muscle. The two kinds of muscle it's composed of is smooth muscle and skeletal muscle. So it starts with skeletal muscle, and skeletal muscle is going to be this navy blue here. Skeletal muscle. So I'm going to do some diagonal lines here, and that's going to represent skeletal muscle. So our smooth muscle is going to be in a dark green. And I'm going to do diagonal lines in the opposite way. All right, so as you can see, for skeletal muscle, I'm just gonna draw some markers in here just so we can see it a little bit more clearly. It's split up into thirds. Like those lines aren't obviously, you know, anatomical structures, but I just want to note that it's split up into thirds that way. So we have skeletal muscle, which composes the first third, and the second third is composed of mixed skeletal and smooth muscle. Then the most inferior third is made up of smooth muscle. Now remember, skeletal muscle is voluntary and smooth muscle is involuntary. So that's how we can kind of get ourselves to swallow and get food to begin to move down the esophagus. But later on, it becomes more involuntary that we have what we call a bolus of food, or essentially like a ball of food that we chew up to go down through our esophagus. Okay. Now, what we're going, you know how we had an upper esophageal sphincter? we're going to have a lower esophageal sphincter, which is usually right below the diaphragm. So the diaphragm is going to be our border here. And let's draw that sphincter out. So that sphincter is going to be in red, and that's going to be our lower esophageal sphincter. Now, the sphincter has a couple different names. It's also called the cardiac or gastroesophageal sphincter. So I'll put those in parentheses. Cardiac or gastroesophageal. Now, the reason for that is it's going to meet up with, not the heart. I know the cardiac is what we know as heart, but there is a certain part of the stomach called the cardia that's going to be right here. That's why it's called the cardiac sphincter. And then gastroesophageal, whenever we talk about gastro, we're always talking about the stomach. So that's why it's sometimes called gastroesophageal, because it's that border between esophagus and stomach. Now, before we go on, we're going to actually label a few other things. So the other things that are in our head that contribute to us breaking food down in this first place, which is the mouth, is actually salivary glands, because they produce saliva that helps break down our food as a first step. So we talked about it going all the way down the esophagus so far, but let's also talk about the salivary glands that provide saliva that help facilitate that digestive process. So let's start with the first salivary gland. The first salivary gland is going to be parotid salivary gland, and that's actually going to be the biggest one. So that's going to be right around where our jawline is. So it's going to be a little bit higher, kind of like around the ear area as well. So that's going to be parotid salivary gland. So next we're going to have our submandibular gland or submandibular salivary gland, and that's exactly what it sounds like. So we have the mandible right here. Remember, that's kind of like the jawbone right there, and then right underneath the mandible we're going to have something called a submandibular gland. Salivary gland. And then our last salivary gland is again going to be just like it sounds. It's going to be our sublingual gland, and that's going to be right underneath our tongue. So it's going to be about right here. All right, so we talked about all these salivary glands that are going to produce the saliva to be in our oral cavity to help break down food using that saliva. And then we're also going to have teeth that is going to break things down. It's going to send it through this entire beginning of the digestive system all the way until it gets to the esophagus. But let's not forget to identify those different teeth. Okay, so we're going to take a little bit of a quick detour, and I'm just going to review teeth for us. And then after we get back, we're going to go right back to where we left off with that lower esophageal sphincter. Now, for teeth, there are some different names for them, and it's actually not too complicated, but I want to draw them out for us. We could draw them out in a big circular fashion, how they actually look when we open up the mouth, but I think it's a little bit harder to do that way. So I'm going to be drawing it as if you're looking at someone's smile, but it's just like stretched out. So we're going to draw the teeth, but just opened up as if we're looking at an anterior view. But I just open them all up because it's a lot easier to draw, essentially. So let's do top and bottom. So our teeth are just going to be squares again because it's easier to draw. So we're going to have 5, and then I'm emphasizing our canines just because it makes it a lot easier to kind of memorize them. And then in the middle, we're going to actually have 4. And then we're going to have canines again. And then 5 on the side. 1, 2, 3, 4, 5. Alrighty. So this is going to be our teeth, which again, remember, it does mechanical breakdown, so it actually like crushes the food to help us. And that's the beginning of the digestive process, actually. So I'm going to write little numbers on here. So whenever we're counting these teeth out in terms of identifying, for example, specific molars, so molars are on the side here. So remember, this is as if someone's gums are up here. This is their top teeth, and then we're going to have bottom teeth on the bottom. And normally, teeth are kind of like rounded, like, I don't know if this is a great example, but it's as if we're looking at someone's mouth like this, like their teeth are there, but then we just spread it all out. So I just flatten their teeth out. So here are the those pointy teeth. But we're going to start with the molars, which are these guys in the back. Now, whenever we're numbering molars, we're going to talk about them from medial to lateral. So I'm going to write a little number on these. Actually, I'll do that after. Let me just label. All right, let's do molars first, just like we talked about. So molars are going to be those ones all the way in the back. So we're going to have our first through our third molars. And remember, when we're counting, we're always talking from medial to lateral. So this is going to be our first, second, and third. All right, I know those little labels are small, but first, second, and third. And then the next thing, if we're working lateral to medial in this picture, but like posterior to anterior when we're talking about our actual teeth, the next ones are going to be our bicuspids or premolars. So those are going to be blue for us. And then we're going to have a first and second. So again, the first is going to be more like anterior or central. So first and second. First and second. All right, so remember I was talking about these pointy ones. They don't always look that pointy in people, but and like, I don't know, cats and cheetahs and stuff, they look a little more pointy like that. Sometimes people do have a little bit more pointy ones, but usually there's a little bit of a point on it. And those are called our canines or cuspids. Alrighty, then when we get to the middle, we're going to have lateral incisors, which are, of course, more lateral. And then it would make sense if we had medial incisors, but they're actually called central incisors. So I don't know, that always bothered me. But you know, what can you do? I can't rename anatomy things as much as I would love to. Again, those are going to be our central incisors. Now we're going to have the same teeth, or it's going to be labeled the same for the top teeth or the bottom teeth. I just drew at the top because it was a little bit easier. One thing to note is that the third molar is also called wisdom tooth. So if anyone has ever had their wisdom tooth pulled, there's some funny videos out there talking about or showing people after they've had them pulled. But anyway, so that is the beginning of our digestive system. Okay, so we went over our teeth that chomp everything up, and the saliva that helps break it down. That's all our mechanical breakdown from those teeth. And then we are going to have that food that we eat go down all the way into our esophagus. And now we're going to pick up at this lower esophageal sphincter and diaphragm and everything. So that's what we're going to pick up. Okay? So remember I said after the esophagus is the stomach. So that's what we're going to do next. We're going to just draw the stomach itself, so that's what I'm going to draw out first. Now, let's get started with that. All right, so we had our diaphragm. Actually, let me label it stomach. All right, so we had our diaphragm. And then what we're actually going to do is I'm going to, you know how we were looking at a lateral view over here? I'm going to write that in to make it a little clearer. I haven't been writing it in lately because we've been drawing a lot of side views of someone's head, which is pretty obvious, you know? But now we're actually going to draw the stomach out, and I want you to be able to see it a little bit differently. So we're going to actually look at an anterior view. Alright, so we got our anterior view. Here's our diaphragm, that's always our little landmark that we're looking at. Now, remember we had our esophagus go down, and it goes down until just below our diaphragm. Remember we had our esophagus, and then we have that lower esophageal sphincter. And what's going to happen there is that's going to be the border between the esophagus and the stomach. So let's draw the stomach out now. The stomach looks a little bit funky, so we're going to do our best to do that together. Draw it out. It has such a funky shape. So that's my greatest attempt at a stomach. Alrighty. So let's label a couple of things just to start out, because I want to make sure we're all oriented to where we are. So I'm going to try to use the same colors. Here's my esophagus color. And then we have our lower esophageal sphincter, which is also called our cardiac sphincter or gastroesophageal sphincter, but I'm just going to label it as one thing right now. Alrighty, so that's the border between esophagus and stomach. So now we're going to label different parts of the stomach, okay? So let's start with the first part that food will go into. That is called the cardia. That's where that name cardiac comes from. Alrighty. Now, the next part that we're going to label is called the fundus. No pun intended, but it has a really fun name. The fundus. I was thinking about like fun is our top priority, right? In anatomy and elsewhere. So I was thinking about fundus as being towards the top, which it is right here. Here is our fundus. It's a little part of the stomach that's like poking most superiorly. Alrighty, then we are going to have the body, which is going to be the, like, essentially most of the stomach. Note to self, do not put yellow where black is, because then I get these ugly little spots. But anyway, you get the point. The body is yellow. And then the last little part of our stomach is called the pylorus. Now, one thing I forgot to say that is in terms of the stomach itself, the primary purpose is storage. So I'm just going to write that here. Primary purpose is storage. So we had our esophagus bringing that food down, going through that sphincter, and now it's essentially storing food and helping to use stomach acid to break it down, and the muscular component as well. But really it is just a storage facility before we do more digestion as we keep going. So let's see, now we have all the different parts of this structure of the stomach, but just like how whenever we have a transition from one structure to another, like we did with the esophagus and the stomach, right here we had a sphincter, we're going to have some sort of sphincter there usually, or some sort of valve at least. So here we're going to have another sphincter just as we did before. And let's see, that sphincter is going to be, we'll make it brown. Just like we have our pylorus right here, we're going to have a pyloric sphincter. Alrighty, so we're going to have a couple of different landmarks as well. So our first landmark on our stomach is going to be called our greater curvature. So that's going to be our big curve here. Greater curvature. And then if we have a greater curvature, we're also going to have a lesser curvature. It's going to be this smaller curve right here. Now, those names are important because they serve as a connection for another piece of tissue, or connective tissue actually, that's pretty important. So I'm just gonna make this a little bit wider. There we go. So that is an attachment point for, again, like I said, connective tissue. It's going to be something called the greater and lesser omentum. Now the greater and lesser omentum are going to connect the stomach to other structures in the gastrointestinal or the digestive system that we're talking about. And it's going to help kind of like stabilize it, and it is connective tissue. So let's draw those guys out. So we're going to have our lesser omentum, which is just going to be all of this connective tissue. So we're just going to draw it like nice squiggles there. That is our lesser omentum. And then we're also going to have a greater omentum. Now, there's something in the stomach that I want to point out to you. I'm just going to draw it in gray here. It's just going to be these little folds in the stomach, and the name of those folds is rugae. And those are gastric folds. And whenever we have folds in something, it's usually either to help with absorption or help with surface area and therefore volume. So, all right, so we have our rugae. Now, one other thing that I want to point out is that the muscles of the stomach, right? The stomach is going to take food and it's going to squish it. So the muscles of the stomach are going to be, we're actually going to have like 3 different layers of them. So let's draw another stomach down below just so I can show you that a little bit easier. So again, I'm going to do my best to try to draw this out in a not terrible way. All right. So here's another stomach down below. Now, to show you the different layers, we're going to use some different lines. So we'll label this stomach muscles. And let's move from superficial to deep. All right, so we're going to have longitudinal muscles, which are going to be most superficial on the stomach. We're going to have circular muscles. I'm only drawing it in one part of the stomach just because it would become a lot if I were to draw it over the whole thing, but so just note that it is in multiple different places. But here we go, we have our circular muscles, which remember we're going superficial to deep, so that's going to be our middle layer. And then our last layer is going to be our oblique muscles. Oblique. So those are the 3 different layers of stomach muscles that help it kind of squish the food around to help with that digestive process. Now, something to note here is oftentimes with the stomach, people will talk about having a stomach ache, but our stomach is actually in our epigastric region, which is like that upper middle part of our abdomen. So oftentimes when people are like, oh, I have a stomach ache, they just mean that their abdomen hurts instead of their stomach itself. So that's interesting. But you know how we talked about this lower esophageal sphincter or gastroesophageal sphincter? There's actually, if you've ever had heartburn, that's usually referred to as GERD, so gastroesophageal reflux disease. And that can happen for a number of reasons. The most common ones are actually something called a hiatal hernia, which is essentially part of the stomach. So here you have the diaphragm, but there's like a little opening for the esophagus in the diaphragm that allows it to penetrate the diaphragm. But you can have something where a part of the stomach comes back up through that hole, and it can cause a lot of discomfort there. So that's one cause of GERD, so gastroesophageal reflux disease. I'm just going to write the abbreviation in. That's the fancy name for heartburn. So that's one cause of that heartburn, but the most common cause actually is lower esophageal sphincter dysfunction. So what's interesting about that is oftentimes physicians will prescribe antacids for that condition, but these antacids are usually meant to be used just sparingly, right? Over the course of like a month or something. We're talking about like Pepcid, Prilosec, all those things. And there are actually some correlations with those antacid medications with conditions like osteoporosis and even different like kidney and heart conditions. But the thing is people aren't using those medications for a month. They're using them for a lifetime. And the reason why those are prescribed is because it's often thought that there's too much acid production in the stomach that's going back up into the esophagus and causing that burning sensation. But what actually happens is it's this lower esophageal sphincter that doesn't work correctly. So, but if people are taking these long-term antacids, yes, it does decrease the acid, but you know, what actually stimulates closure of this lower esophageal sphincter, which is made of smooth involuntary muscle, is stomach acid. So in doing so, by taking an antacid, not only are you just essentially putting a band-aid over the problem, and oftentimes people have a rush of onset of worsening symptoms after the antacid is no longer effective, but you're really perpetuating the problem because you're inhibiting the acid that's going to stimulate the closure of this lower esophageal sphincter. Now, what can you do? I've taken a really great course on visceral mobilizations of the gastrointestinal system, really focusing on fascial connections or like connective tissue connections to different structures in the gastrointestinal system. And I can, like physical therapists who are trained to do so, can help stimulate improved function of the lower esophageal sphincter and help with focusing on paying attention to connective tissue that's connected to the stomach to help with that. So that's just a little fun fact about that. But that covers what we need to know for the stomach. So next, what we're going to do is we're going to move to the next phase of digestion. So we covered the stomach already, but next it's going to move into the small intestine. So we're going to end here at this pyloric sphincter, and we're actually going to pick up there again, just like we did with the lower esophageal sphincter in the esophagus. Alrighty, so let's pick up where we just ended, and we're going to now talk about the small intestine. We're going to again do an anterior view. And just for a frame of reference, I'm going to draw some other structures out as well. So as always, we have our nice diaphragm right here. Right below that, we're going to have our liver. So I'm going to draw that out. Then we're going to have our stomach. which again, let me try to not mess up here. It's actually a little bit behind the liver, but I'm taking it out of the picture just a bit. Ooh, that stomach is squished. That is not fantastic. But anyway, you get the idea. There's my poorly drawn stomach. Now, next we're going to have our small intestine as the next step, okay? So let's start drawing that out. The thing is the small intestine is huge. It's really, really long. So it's broken up into 3 different parts, and it's about a total of 21 feet long. So I'm going to simplify it a lot, but really it's like a huge mess of swirly small intestines right here in the middle. I'm just going to draw it simplified just to make it easier for us. So here, let's label those structures. All right, so the liver is always in this nice, like, deep red color. So that's what I'm gonna label it as whenever I remember to. So that's our liver. And then we got our nice stomach right here. And then remember, last time we ended at that pyloric sphincter. So we're gonna do the same thing right there. Pyloric sphincter. All right, so that's the end point of the stomach and the beginning of the small intestine. Now remember, our small intestine is a big mess of just like a big noodle or inner tube all folded all up. Now we're also going to have our colon. So let me draw that in because our colon kind of or a large intestine kind of surrounds things. It's gonna have a bunch of folds. All right, so that's our colon. And then we're going to have our small intestine. That's going to go through here. And there's going to be, it's just going to be a bunch of squiggles here. So it's gonna look like that. And it's not gonna be this like uniform. That's my attempt at a small intestine. But instead of just like squiggles like that, there's gonna be like 21 feet of that all balled up into a big ball. All right, so. All right, so that's our handy dandy small intestine. All right, so for the small intestine, remember I said we are going to have 3 different parts. So I'm just gonna write small intestine. So we're going to start at the part that connects to the stomach. So that is going to be our duodenum or duodenum. You can say it either way. It doesn't really matter. Alrighty, so that's going to be right here. And remember, this is super duper long, but I'm just drawing it like that to simplify it. So and that's gonna be somewhere around 1 foot long if we were to like take it out and stretch it out. Then our next part of the small intestine is called the jejunum. That's going to be about 8 feet long if we were to take it out and stretch it out. And then our last part of our small intestine is our ileum. I attempted to make this look like a tube, but I messed up here a little bit, so just again, ignore the fact that my drawing skills are subpar. But this is going to finish off our small intestine with our ileum right here, which is about 12 feet long if stretched out. Don't worry about knowing those numbers. That's just for a little guidance for you to know, you know, what if realistically, all my terrible squiggles here, that it's actually a lot longer than what we think. All right, so, one thing I forgot to note is that I always like to talk about what the purpose is. So the purpose here for the small intestine is to do digestion and absorption. All right, so we covered the small intestine there. Now, a few other things to note. We're going to have something called the mesentery, which is essentially the way that the small intestine attaches to the posterior abdominal wall. We're actually going to have a mesenteric root where it's going to attach, but it's just going to be some of that connective tissue, kind of like the omentum that we talked about, a little bit similar to that. So it's very difficult to draw that in a drawing like this. So what I'm going to do is I'm going to kind of draw it out, but then I'm going to leave it up to you to look at the picture that I posted on Canvas, to look at this structure on the mesentery on the small intestine, and then you're going to actually compare that to the mesocolon that I'm going to draw out as well. So I'm just going to draw like a little bit of pink stuff in here for right now, but reference that picture that is posted, because it makes it a lot easier to understand. And as always, it's always important to be looking out for pictures of things that I'm drawing. So, or like actual anatomical pictures. So that again is our mesentery. All right, so again, that connects to posterior abdominal wall. Wall. Alrighty. So the other thing that I want to talk about or a couple of other things that I want to talk about with the small intestine is that it has both circular and longitudinal muscles. So let's see. I'm just going to draw those in this dark blue right here. Circular and longitudinal muscles. All right, so then we're going to have something called plica circularis. And essentially, those are folds in the small intestine to increase surface area to improve absorption. So let's just draw a little note there that we're going to have little folds. That's my attempt to draw them out right there. But essentially it's going to be folds in the small intestine. Plica circularis. There we go. Folds to increase surface area for absorption. Alrighty, so that's drawn on the outside. It should sort of be on the inside, but that was my attempt at it. And then the last thing that we're going to end with right here is going to be the ileocecal valve, because remember the last part of this small intestine is called the ileum, and this part of the large intestine or the colon is called the cecum, so ileocecal valve. Remember, we always start with some sort of sphincter or valve when we're beginning or ending any part of anything. All right, so that covers what I wanted you to know about the small intestine. Now, let's move into the large intestine. And, for now, I think I'm actually going to keep this on the same paper. It may be difficult because we are limited in numbers of colors that we have, but we're just going to work with it. All right, so we're gonna change our label to small intestine / large intestine. Sweet, there we go. Alrighty, so like we said, this first part here is called the cecum. So we're gonna do that in like a pink color, bright pink color right here. So let's underline small intestine. So we knew that that's what all of this stuff is. And now we're going to start with large intestine. All right, so what did we just do? We did our cecum. Then the next part, it's actually pretty intuitive. So we're going to have ascending, transverse, descending, and then sigmoid colon. So let's take this ascending colon and make it a nice turquoise color. Ascending colon because it ascends, transverse because it goes across transversely, right here. I'm actually a little bit impressed with my little colon here. I'm happy with him. My smaller intestine has seen better days, but we're working with it. We're doing the best we can. I work with colons all the time in my work as a pelvic physical therapist because oftentimes people come in and see me about constipation, and the colon is really involved in constipation and the small intestine and everything really in the abdomen here. But that is our transverse colon. Then we have our descending colon. Need to get some new colors here. I'm running out. Descending colon. And then we have something called our sigmoid colon, which is like this curved area right here because it looks a little bit like a sigmoid, which is like that little symbol. What haven't I used yet? Man, I used too many colors. We're going to do this pink color here for our sigmoid colon. It's kind of like S-shaped, as you can see. And then we're going to have that turn into our rectum. All right, so our rectum is going to end, and then we're going to have something called our anal canal. And within the anal canal, we're going to have our internal anal sphincter and external anal sphincter. So let me start by drawing let's do the anal canal in like a dark green. That's our, so large intestine, oops, goes from here to here. Small intestine goes from here to here, but we're also like loosely talking about the small intestine here. Now, so we have, what did I just label? Our anal canal. And then we're gonna have our anus as well, which is just gonna be like this very end part right there. Anus. Now remember, at our anal canal, we're gonna have two different sphincters. So I'm just gonna show you them as two different little red dots to represent our two different sphincters. We have internal anal sphincter, which is most internal, and then external anal sphincter. Now, our internal anal sphincter is a smooth muscle, so involuntary, and our external anal sphincter is skeletal muscle, which is voluntary. So, let's say internal anal sphincter, which is smooth muscle, and then external anal sphincter, which is skeletal muscle. Now, that is important because we care about that. Our internal anal sphincter will open up without us having control over it. But our external anal sphincter is something that we can control. So when we sit down to have a bowel movement, it's really important that we're able to relax and open our external anal sphincter. So for me, for example, as a pelvic physical therapist working with patients who have trouble with constipation, there's something called outlet constipation where you can't get stool out of this very end part, which is your external anal sphincter. So a lot of times I'm teaching people and coaching them on how to open and widen their external anal sphincter to allow for stool to come out. Now, there's also things we can do manually meaning using our hands to help facilitate movements of stool going all the way through our colon. something we can do for that, for example, is called an ILU massage. So if you look down at your stomach right now and you trace the pathway of your descending colon, it's going to go in, it's going to look like an I if you're looking at your belly. And then from transverse to descending, it's going to look like an L. And then ascending, transverse, descending is going to look like a U. So we can have people actually apply like a gentle scooping motion along the pathway of their colon to help facilitate improved bowel movements, which I think is super freaking cool. So anyway, now what I want to do is I want to label a few more things on this large intestine or the colon, because I want to make sure that we label all of the different areas. So one thing that is, let's see, I'm going to draw a little distinction between small intestine and large intestine. The only thing is I don't have quite enough color, so we're going to try to work with what we have. We're going to have a little thing hanging off of our cecum right here. That's going to be our appendix. Remember, we just had our lymphatic system lecture, and with that, we talked about the appendix being an accessory, and we said we'd mention it again, and now we are. So we have our appendix there. We are also going to have, see where there's like a little flexure right here where it makes a little turn, and a flexure right here as well. We're going to call that our hepatic flexure and our splenic flexure, because we're actually going to have our spleen right up in this area. So let's label those. Man, I used up all of my colors. What am I gonna do? I will, you know what? What I'm gonna do is I'm gonna have liver in a box right here because I just outlined the liver, and then I'm gonna have stomach in a box right here because I just outlined the stomach. So that's gonna be your cue that that's the liver and stomach, and hopefully we know that by now. So we're going to then free up these colors right here. So this little flexure right there, that is going to be our hepatic or right colic flexure. Hepatic, we're just going to call it hepatic flexure. That's all you need to know. And then we're going to have this little flexure right here, our splenic flexure. Remember when we're talking about hepatic, that's always referring to the liver, and splenic is always referring to the spleen, just like we covered when we were talking about our circulatory system and blood flow. All right, so we covered those flexures, just a few other things. We're going to have something called the mesocolon. Remember, we talked about that before, and that's going to be the connection of the large intestine to, it's going to be kind of like stabilizing it. It's going to be that connective tissue that's kind of analogous to the mesentery in the small intestine. So I'm just going to draw some of that in this orangey color right here. I'm not going to draw it all in just because that would be very time consuming. But the key is that this is connected to our colon. And again, you can see a picture of it on canvas. All right, that's the best we're gonna get today. That is our mesocolon. Now for our, remember we're still on large intestine, we're gonna have two other things that I want to point out. The first one is going to be Hostra, and that's essentially just these little pockets here. So I'm going to draw a little pocket in. We're going to reuse this light green color that we use for pyloric sphincter. Just remember that pyloric sphincter is right there. I'm going to highlight a little pocket right here. And that's going to be our Hostra, or a little, like, essentially a little pocket right there in the colon, or large intestine. And then the other thing that I want to point out in the large intestine is that it has 3 bands of longitudinal muscle, and that's called, it's hard to pronounce, but it's Teniae coli. So I'm going to draw that in, let's see, what am I going to use? I don't have any colors left. Man, life is tough, right? Alright, I'm going to do just black. So obviously we can't see all 3, but that's just one of them. So that's going to be our, oops, make sure I spell this right. Teniae coli, which is 3 bands of smooth muscle. So remember, this is all large intestine stuff. Right there. This is our little nice large intestine box. And then we're going to have a small intestine box, which is actually going to go to here. So all of this stuff here is small intestine. All of this stuff here is large intestine or colon. And I think that's all I want you to know. The Hostra, those little pockets right there that we drew in that little green, it's important just because it helps kind of facilitate transport, because it helps with this action called peristalsis, which is essentially like the squishing and churning of these parts of our intestines to help move food along. Now, what's interesting is this ileocecal valve is really important. So there are 2, this isn't something you need to know, by the way, but just for your information, for the ileum, it does a couple of different actions. It does something called segmentation, which is it breaking stool up into segments, essentially. Remember, the ileum is this last part of the small intestine right here. And it also does something called motility. So it brings this stool along and helps it move. Now, when the ileum is focused on more motility, this ileocecal valve has to open to allow for things to get out. And with stomach activity, it increases the ileal segmentation and motility. So that's really important, because oftentimes if you've ever had stool where it's just like little balls of things like that seem like they're segmented up, it may be something going not so great with your ileocecal valve, because if this valve isn't opening up, which is what happens during motility to get it to move into the cecum and the rest of the large intestine, the ileum is just segmenting and not actually taking the time to help things move along. So it'll almost kind of get stuck there a little bit if this ileocecal valve isn't opening up and allowing for as much motility. So there are things that, again, we can do as pelvic physical therapists, where we use our hands on, you can actually feel the ileocecal valve from the outside, and we have different techniques that we can utilize to help facilitate movement and activity of that valve. So I could go on and on. This is the GI system is one of my favorite things to talk about, but I'll leave you at that for now. So we are covered with small intestine and large intestine. The next thing we're going to do is we're going to move into the accessory digestive organs. So stay tuned for that in one moment. Let's start that now. Oh, one thing that I did forget to say is that, remember we were talking about our internal and external anal sphincter down here? Those are part of our pelvic floor muscles, which again are innervated by, remember we said S2 through 4 keeps the pee off the floor? Well, it also keeps the poo off the floor. So these are innervated by S2 through 4, just like our other pelvic muscles. All right, I wore out my poor GoPro with my love for the digestive system, but we're back. Okay. Now we're going to move on to accessory digestive organs. I think there's one R in that. Accessory digestive organs. So we covered the digestive system as a whole, but there are some other things we do have to cover as well. So let's start with the pancreas. Alrighty, so I'm going to draw some surrounding structures. We all know what the liver looks like now, so I'm going to draw this handy dandy liver in right there. And then I'm going to split it up into a couple different sections. We're going to draw our pancreas as well. And we have already labeled the head, body, and tail of the pancreas when we covered our endocrine lecture, so I'm not going to do that. But the lever is actually much bigger. I'm just drawing it here smaller because it makes it easier. But here's our pancreas. I'm also going to draw a spleen in right here. And then I'm going to draw our duodenum right there. So let's go through and label all these things. We got our liver. Then we got our spleen. We got our duodenum. And then, of course, our lovely pancreas, which I didn't do the greatest job of drawing, but you know, again, we're gonna work with it. Pancreas. Okay, so our pancreas is really important because it produces digestive enzymes. So, you know, I always like to write a little purpose. So the purpose of the pancreas is to, in terms of the digestive system, not the endocrine function, it is to secrete digestive enzymes into duodenum. All right, we got a little purpose there. Now let's draw some things out. So for those digestive enzymes, we're going to have two different pancreatic ducts that they're going to travel through. So we're going to have our main and accessory pancreatic duct. So let's draw our main pancreatic duct first. It's going to go across here, and then it's going to go right over to the duodenum. main pancreatic duct. All right, then we're also going to have an accessory pancreatic duct, which I will do in light pink over here. Accessory pancreatic duct. Now we have these digestive enzymes in the pancreas, and they're going to make their way into the duodenum. But with that, we're actually going to have something else, which is going to be coming from the liver. So we're going to have our right and left hepatic ducts coming from the liver. So let's draw those in. It's going to come from both different lobes of the liver, which we're going to review in a moment. But let's make those nice and thick so we can see them very well. We have our right and left, hepatic ducts. Now those are going to meet in the center, and they're going to meet at what we call the common hepatic duct. So let's do that here. Common hepatic duct, and that is actually going to meet up with something else. So we're going to have actually a little thing on our liver that's going to be our gallbladder. Now we'll go over that in a little bit, but we're going to have something going from our gallbladder to our common hepatic duct, and that is going to be called our cystic duct. So let's draw that in. Let's see. I'll do that in like a deep green. So that meets up with our common hepatic duct. Cystic duct. And then what's going to happen is when those structures meet, they're going to form a common bile duct, which is going to meet up with this main pancreatic duct. So I'm going to do that in like this bright orange. So it's going to come down, and I'll draw like a zoomed in version of this as well. And it's going to meet up with our main pancreatic duct. So again, that's going to be called our common bile duct. And that is going to meet at a structure. That structure is called the hepatopancreatic ampulla. I know, we got a lot of crazy names going on here, but that's where these structures come together. It's hepato because some comes from the liver, and pancreatic because some comes from the pancreas. So hepatopancreatic ampulla. All right, so that's our hepatopancreatic ampulla, and then the hepatopancreatic ampulla is going to enter the duodenum at something that we call the what do we call it? The duodenal papilla. So let's draw that in. Duodenal papilla, where the hepatopancreatic ampulla enters the duodenum. Alrighty, so this is how we have a connection from the liver and pancreas into the duodenum. Now I know this is super tiny, so let's do a little zoomed in view of that just so you can see a little bit clearer. Now we're going to have, the right and left hepatic ducts. So let's start with those. Coming together like that. And then we're going to have the common hepatic duct where they meet together. Then we're going to have our gallbladder off to the side here from our liver. And then we're going to have our cystic duct come from that and meet up with our common hepatic duct. And then those two, as they travel together, they're going to be traveling in what we call the common bile duct. On their way over. And then we're also going to have our main pancreatic duct that's going to meet up with it that came from over here. And it's going to meet up at the hepatopancreatic ampulla, which is going to enter the duodenal or the duodenum through the duodenal papilla. So this is just a zoomed in version of this. Alrighty, so that covers essentially what I want you to know for our pancreas. So we have the head, body, and tail, which we already went over before. We have a main and accessory pancreatic duct that's going to help secrete digestive enzymes into the duodenum, but it's also going to have a really important relationship to the liver because we have our hepatic ducts forming our common hepatic duct, taking bile from the liver, and I'll review bile in a moment, but that's going to come together and it's going to be able to all secrete those things together into the duodenum. Okay, so now let's take a little bit of a closer look at now that we looked at this, we call it the bile pathway along here, where we have things coming from the liver and the gallbladder. But I want to clarify that a little bit more. So let's actually go into our liver and gallbladder. Alrighty, let's do it. Liver and gallbladder. Alrighty, so the liver, it is going to produce bile, which emulsifies fat. Now our gallbladder is going to store bile. So that's the functions of both of those together. Now let's draw a liver out. This is going to be an anterior view. I'm going to split it into the right lobe and the left lobe. Now, just for reference, we're going to have some structures that are posterior to the liver, and let's draw them out. We're going to have the aorta right here. And then we're also going to have the inferior vena cava. Let's color that in. Just so we know where we are and who's in the neighborhood, you know? Alrighty, so now that we have the liver in a couple of different structures, we split it up into lobes. We have our right lobe and our left lobe. This is an anterior view. Now we're going to have actually a couple of other lobes when we look at it posteriorly. But let's see. Let's draw that posterior view out right now. So this was hard for me to do because it is hard for me to flip a liver around in my brain, but let's do it. Oops, that liver is a little squished, you know, but we made it work. Alright, so we're going to have our gallbladder kind of poking out here, but we're going to be able to see it much clearer posteriorly because it's going to be a big structure, kind of like that. So that's our gallbladder. Alrighty, now let's actually label these on our posterior view. Oops, oh, I messed up. This is going to be our left lobe because we flipped things around. I'll label which view this is in a moment as well. So that's our anterior view. And then we're also going to have a posterior view. So this is going to be right, left, left, right. Alrighty, so from the back side, you can actually see a couple of different lobes. It's going to be our caudate lobe, which is that lobe right there. And then we're going to have our quadrate lobe as well. So now we have all of the 4 different lobes of the liver covered. We know that it makes the bile, and we know that we have the right, left lobe, caudate lobe, and quadrate lobe, and these 2 you can only see posteriorly. Now let's talk about a little bit more detailed structures within the liver. So we're going to take kind of like a microscopic view to look at things, and let's look at the functional unit of the liver now. Okay, so the hepatic lobule is the functional unit of the liver. Now let's draw this out here. So here is a hepatic lobule, and we're going to draw a couple of different things. In the center. So remember, this is a functional unit of the liver as if we're like really zooming in and looking at, there are a bunch of these little hepatic lobules within the liver. So this is just like a zoomed in view. So in the center, we're always going to have the central vein. And then we're gonna have some little connections to each area here. And there's gonna be, it's gonna look kind of like that, but essentially at each corner we're gonna have something called a hepatic triad, but our way of connecting our central vein to each hepatic triad is gonna be something called hepatic sinusoids. And then for each hepatic triad, we're going to draw a little circle here. And it's called a triad because it has three different things, or three different little vessels running through it. And those vessels, one of them in each of the triads is going to be the hepatic artery. Then we're also going to have the hepatic portal vein. And a little vessel from that traveling through each hepatic triad. And then lastly, we're going to have a vessel from the bile duct traveling through each hepatic triad. So therefore we have little vessels from all three of these different aspects of the hepatic triad traveling all throughout the liver. And that's how the liver does its job, is through these hepatic lobules, which is the functional unit of the liver. All right, so just to wrap things up, I want to do a little bit of a quick recap and just talk to you about the different things that we covered. Also, sorry, at one point I did talk very quickly because I was running out of memory space on my GoPro that I'm using, and turns out that I ran out, so me talking really quickly didn't end up saving me an extra trip of downloading and deleting stuff and then re-recording. So anyway, I apologize for talking really quickly during one segment of this, but just to review, we covered the digestive system. So we talked about food coming in through your mouth, through your teeth, going through all these different areas and down your esophagus. We talked about the different teeth that we chew things up with. We then move from the esophagus into the stomach, and the stomach stores stuff, but it also uses acid and muscles to help break things down. We talked about the different muscles that the stomach uses to do that, and some different little characteristics of the stomach. Then, from the stomach, we moved into the small intestine, which is a bunch of these squiggles. Remember, it actually is way longer. It's about 21 feet total, or give or take, with all those three different aspects. Then it moves through the ileocecal valve into the large intestine, or the colon. I'll write that in, colon. And it goes through all the different parts of the colon here, then through the rectum, through the anal sphincters, and then out through the anus. And that's how food goes from our mouth, moves through our whole digestive system and out of our body. But we can't forget about our accessory digestive organs. So first we talked about the pancreas, and the main digestive action of the pancreas is to secrete those digestive enzymes that goes through those ducts and enters the duodenum. And with that, we can't forget about the liver and the gallbladder, because that also enters produces and stores bile that will enter the duodenum to help with digestion as well, which makes these all accessory digestive organs essentially. So we went through the liver and gallbladder and what they do in terms of bile, the different aspects of it, and the functional unit of the liver. And that wraps up our lecture on the digestive system for today. So there we have it.